Imagine you're in a room filled with your favorite foods. How do you react? Are you staring at the food, just waiting to pounce, or are you able to just take a couple of bites and then turn away nonchalantly? If you are in the first category, this video is for you. There is help. But first, you have to know just what you are dealing with. Now, there's a common misconception that's been floating around, causing confusion. Many people mistake an eating disorder for food addiction or vice versa. It is understandable. Both conditions involve the struggle to keep your food cravings under control. They seem to be two sides of the same coin, but in actuality, they're not. It's like comparing apples with oranges. They're both fruit, sure, but distinctly different. Though they may seem similar, eating disorders and food addiction are fundamentally different, like apples and oranges. This distinction is important to make, especially if you are struggling with overeating and just can't seem to get control no matter how hard you try. An apple a day keeps the doctor away, but what happens when apples become the enemy? Let's explore the complex world of eating disorders. Now, it's important to understand that eating disorders aren't just about food. They are serious, often life-threatening conditions that affect a person's emotional and physical health. There are three main types of eating disorders: anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia is characterized by an extreme fear of gaining weight and an altered body image, leading individuals to starve themselves or exercise excessively. Paradoxically, although the person with anorexia is terrified about eating the food, nevertheless, they are obsessed with food, just as much as the overeater. Bulimia involves periods of overeating, followed by compensatory behaviors such as self-induced vomiting or excessive exercise. They are eating too much, usually junk food, and are trying to avoid the inevitable weight gain by trying to lose it. It is too many calories in, so let's burn or purge as many calories as we can out. Binge eating disorder, on the other hand, involves recurrent episodes of eating large quantities of food, often very quickly and to the point of discomfort. It does not involve trying to get rid of those excess calories, so often it is the binge eaters that gain the most weight. But keep in mind, all people with eating disorders can be a normal weight. It is what is going on in the mind that counts. Diagnosis of these disorders involves a comprehensive evaluation, considering both physical and psychological factors. For instance, doctors may look for signs of malnutrition, electrolyte imbalances, or other health issues. Psychologists or psychiatrists may assess behaviors, attitudes, and feelings related to eating and weight. They are looking for emotional disturbance. Does the person have a history of trauma? Are they living in a circumstance where they have no control other than the food they are eating? Basically, eating disorders aren't just about what's on the plate. They're deeply rooted in psychological issues. They often coexist with conditions like anxiety, depression, or obsessive-compulsive disorder. There's a fear, an obsession that goes beyond the food. Imagine seeing an apple not just as a fruit, but as a threat to your self-image, or a slice of pie not just as a dessert, but as a trigger for guilt and shame, or as food to save you from emotional distress. When we talk about emotional eating, eating disorders can be the extreme version of this common tool to self-soothe. So, why do some people develop eating disorders? It's a complex interplay of genetic, psychological, and social factors. A history of dieting, body dissatisfaction, perfectionism, and family influence can all play a part in the development of these disorders. Eating disorders are not about food, but about how we perceive and cope with our environment. So when we talk about eating disorders, we're really talking about people trying to navigate their way through life's challenges using food as a tool or a weapon against themselves. Now imagine being irresistibly drawn to that apple, despite knowing you've had enough. You're not just craving it, you're compelled to eat it, as if your very survival depends on it. This is the essence of food addiction, a condition that goes beyond the realm of simple indulgence. Food addiction is characterized by intense cravings and the inability to control consumption, even when it's causing physical harm. It's not about a lack of discipline or willpower, it's about a physiological response to certain foods. Just as a moth is drawn to a flame, those with food addiction are often irresistibly drawn to their trigger foods. So, what foods are we talking about? Research has shown that sugar is a major culprit. It triggers the dopamine circuitry in the reward part of our brain, hijacking our willpower that stops us from eating when we are full. But there are other trigger foods, not just sugar. Triggers, foods are typically foods that are high in sugar, yes, and especially if combined with fat or salt. They are typically of the ultra-processed variety of foods. That would be cookies, ice cream, cake, candy, pizza, even bread, maybe even dairy for some. In common with them all, they light up the reward centers in our brain, releasing a rush of dopamine, the feel-good hormone. It's a bit like the rush some people get from gambling or performing daredevil stunts. But here's the rub. The more we consume these trigger foods, the more our brain demands them, leading to an insidious cycle of overeating. The role of dopamine cannot be overstated in food addiction. It's the brain's way of saying, hey, this feels good, let's do it again. But when the source of pleasure is a trigger food, the call of dopamine becomes a command, a compulsion, a relentless drive to eat, even when we're not hungry. So, you see, food addiction isn't about the lack of willpower or a simple love of food. It's a complex interplay of brain chemistry, behavior, and environment. It's not a moral failing or a character flaw, but a physiological response to certain foods. Did you notice that I have not said much about the individual and their psychological state of mind? So, we've talked about apples and oranges. Do I have an eating disorder or do I have a food addiction? Now, let's compare these conditions. When we think of eating disorders and food addiction, it may seem like they're two peas in a pod. Both groups of people are obsessed about their food, either because they are restricting too much or eating too much. But in reality, they are as different as, well, apples and oranges. Both involve food, yes, but the way they manifest, and more importantly, how they should be treated, are quite distinct. Let's start with eating disorders. They are primarily about control, or rather, the lack of it. An individual with an eating disorder uses food, or the absence of it, as a way to manage feelings of anxiety, stress, or self-worth. It's not about the food itself, but what it represents. The focus is on the act of eating or not eating, and the physical changes that result. In contrast, food addiction is all about the food. It's about the intense cravings, the compulsive eating, and the inability to stop even when full. The focus is on the food, the taste, the texture, the instant gratification it provides. It's a physiological response, a biochemical reaction in the brain that's akin to drug addiction. The food addict eats regardless of their previous state of mind. They can be emotionally upset, or they can be excited and wanting to celebrate. Certainly the person's emotional state can be a trigger to overeat, but it is primarily the food itself that lures the food addict. So, when we look at these two conditions side by side, we see that they are fundamentally different. Eating disorders are psychological, rooted in emotional distress. Food addiction, on the other hand, is physiological, a product of the brain's reward system gone awry. This distinction is crucial when it comes to treatment. For eating disorders, therapy often involves addressing the underlying emotional issues, building self-esteem, and learning healthier coping mechanisms. Tools such as cognitive behavioral therapy, mindfulness, and intuitive eating are used. It's about redefining the relationship with food and with oneself. Too much focus on the food, such as restricting portions or calling junk foods the enemy, are discouraged. Better you learn to eat a little bit of everything, the ED therapist says. than to focus your recovery on tools that will take you away from your emotional dilemmas. Food addiction, on the other hand, requires a different approach. Treatment might involve identifying trigger foods and removing them from the diet. Abstinence from the drug food is a crucial first step. It's about retraining the brain to respond differently to food, to break the cycle of craving and compulsive eating. It's not just about learning to use food differently, but also about how to eat differently. A food plan that has removed all trigger foods is the medicine for recovery. Now, this is not to say that one condition is easier to treat than the other. Both require commitment, perseverance, and often professional help. But understanding the key differences between them can help in getting the right kind of help. So, remember, eating disorders and food addiction may look similar on the surface, but they are fundamentally different. And understanding these differences is crucial in tackling these conditions effectively. Once the distinction is clear, how do you know if you have an eating disorder or have a food addiction? There are tools to help the clinician distinguish the difference, such as the Yale Food Addiction Inventory for Food Addiction, and countless measures to determine what type of eating disorder you may have. But let's be frank. Since both conditions look the same, the overlap of symptoms is so confusing. It is often in the treatment that we can finally make the diagnosis. Did the treatments for eating disorders work for you? If not, then it is time to try the treatment for food addiction. There are a wide range of treatment options available. Picture a buffet, but instead of food, it's filled with varied therapeutic approaches for both conditions. There's cognitive behavioral therapy, the chef's special, designed to change your patterns of thinking and behavior. Then there's the hearty dish of interpersonal therapy, served warm with a side of supportive relationships. And let's not forget the nutritious plate of dialectical behavior therapy, a balanced meal of acceptance and change. For the ones with a taste for the exotic, there's eye movement desensitization and reprocessing, a unique blend of psychotherapy and guided eye movements. And these are just the starters. The main course is the critical part of the meal. The person with an eating disorder will keep eating the same foods that friends, family, their culture provides. The food addict, however, steps out of the normal way of eating, what we call a standard American diet. Their best main course is a plate full of unrefined vegetables, proteins, and fats. Sometimes the portions have to be weighed and measured. It is all about the purity of the food. No trigger foods allowed. The therapeutic options become mainly relevant after the food has been sorted out. The food is clean, and then the CBT and DBT and other tools come after to help the person continue to stay clean, as they say, one day at a time. Don't be disheartened if your journey seems different from others. Each step, each victory brings you closer to a healthier relationship with food. Regardless of the condition, you're not alone. Professionals are ready to guide you, and support groups are waiting to welcome you. It's okay to lean on them. They're the ladders to your well, the scaffolding to your tower, and as much as you need them, they need you. For the food addicts, there is the free Facebook group, I'm Sweet Enough, Sugar Free for Life. Read the book Food Junkies, Recovery from Food Addiction. Remember, it's not about the destination, but the journey towards healing. You will unplug from the food. The power is ours.